What's going on, everybody? It's Spencer Gilmore here, back with another YouTube video. Today we're going to be talking about post-finasteride syndrome. I know this is a really common question most men get whenever they're starting the drug or coming off of the drug. It is a really highly debated topic in the hair loss and dermatology community because it seems to be that either it doesn't exist, it's a really bad issue, finasteride's poison, and all of the above can be kind of true and also be super misleading information. I'm not trying to fearmonger here. I think that finasteride works tremendously well for a lot of men that take it, but there are very severe risks that you should definitely be aware of before you take the drug and when you're on it to look out for, getting blood work done, etc. All of these things should be taken into consideration. And I just want to re-emphasize that I don't think that finasteride should be the first drug that you should be trying if you're experiencing hair loss, especially as a young man, anyone under the age of 21, especially under the age of 18. Before we dive in, I want to be clear, this video is for educational purposes only. If you're experiencing persistent symptoms when taking finasteride, you should seek medical attention from a qualified healthcare provider. And full transparency, I do have a hair care company called Hair Rescue. We've sold to over 10,000 plus men worldwide. It has a combination of RU5, 8841, and minoxidil, and also RU only. And we also have our new product, Advanced Hair Growth Oil, for everyone, but we're not going to be talking about that today. Post-Finasteride Syndrome and what every man should know about it. Today we're discussing the topic as both controversial and important, Post-Finasteride Syndrome, aka PFS. This is a condition that some men experience after stopping finasteride, where side effects persist long after the medication has left their system, and finasteride only has a half-life of about 6 to 8 hours, so after about a week this drug should be completely undetectable in your system. And this is going to be when people who are experiencing symptoms well into the months or even years post-treatment. Also, I'm probably going to be reading a fair bit here just because there's a lot of information. I don't want to get any of it wrong. If you're someone who's looking for more information on post-finasteride syndrome, you can definitely look it up on PubMed and articles like that. But Finasteride Watch is a really interesting website online that I like to browse through and get information from. And then the Bowtied Biohacker on Twitter and X, he also has a website. He talks a lot about DHT and the effects of its body, and he's also a big proponent of natural ways to stop hair loss that don't involve finasteride or 5-AR inhibitors. Now, clinically, when we looked at the trials, post-finasteride syndrome affected an estimated 1% to 2% of men who have taken finasteride. While that might seem like a small percentage, when you consider the millions of men who have used this medication, that could be thousands to hundreds of thousands and potentially even millions of men who have experienced post-finasteride syndrome or just finasteride side effects. And they say that estimated 1% to 2%, they get that from the clinical trial data back in 1998. However, I would argue that it's probably a lot higher, closer to about 20% of men are okay with the drug, seem to tolerate it, maybe don't get the best results, but they don't have bad side effects, and it's more like 15 to 20% of people notice a degree of side effects, which I made a different video on, and how DHT affects your body when you lower it or raise it. One of the things that makes post-finasteride syndrome particularly concerning is that the symptoms can appear even after the finasteride has completely cleared your system. It should be undetectable within your body within a few days, but yet some men, reportedly have these symptoms lasting even months or even years. PFS symptoms fall within 4 main categories. You have sexual, mental, neurological. Mental and neurological are kind of one. Physical, and hormonal. It's important to understand that not everyone is going to experience the same symptoms when they have this drug or PFS, and the severity is obviously going to be dramatically different from case to case. I'd like to stress that the mechanisms behind post-finasteride syndrome are not fully understood by the medical science community yet. They might be, but they're not releasing that information publicly, so we just have to go by anecdotal evidences or websites like Finasteride Watch that have more information about it. But the lack of understanding contributes to the controversy surrounding the condition and the difficulty that some patients face when getting proper treatment for this syndrome. The sexual symptoms of post-finasteride syndrome are usually the most often distressing and some of the most common ones, and obviously the most easily to identify. Sometimes having mental and physical and neurological effects aren't always the easiest to identify, but having a complete lack of sex drive is usually pretty easy to identify. And these symptoms can include a complete or significant loss of libido, erectile dysfunction that wasn't present while taking finasteride, difficulty with ejaculating and changes in ejaculation, genital numbness and or decreased sensitivity, testicular pain or shrinkage, loss of morning erections, and in some documented cases, penile abnormalities, including changes in size or structure. So lots to go off of there, all very interesting things that can happen to you as a man, and definitely things that nobody wants to have happen to them as a man. And I think it comes down to some of the things regarding DHT and how it's actually, they say it's not as needed after puberty in men, but I would argue that that's really not the case. And a lot of also recent research has noticed a pretty high correlation between male fertility and finasteride finasteride when using these 5-AR inhibitors. And some research suggests potential impacts on offspring when fathers use the medication, including reported birth abnormalities and or pregnancy complications. So if you're definitely looking to get pregnant or you are trying to make a baby, definitely don't be taking finasteride. And for many men, these sexual symptoms are life-altering, affecting relationships and or your overall quality of life. I know that they affected me in that way, and I know that they've affected thousands of men that I've spoken to when it comes to things like post-finasteride syndrome or just the side effects of dealing with it while on the drug. Post-finasteride syndrome is usually a little more rare than if you get side effects from taking it, and once you get off the drug, usually those side effects should subside within about a month, but it does take your body a little bit of time to recalibrate, adjust its testosterone, DHT, and estrogen levels. So give it some time, but definitely don't be taking the drug anymore if you did suffer from those side effects, because you're probably someone who is DHT sensitive when it comes to neurological, sexual, and physical things. These are some of the mental and neurological symptoms of post-finasteride syndrome, and equally serious and can include depression, anxiety, cognitive impairment, often described as brain fog. I know that was definitely one for me. Memory problems, emotional numbness, sleep disturbances, and or severe cases suicidal ideation. Those are some of the ones that are really hard to self-diagnose, especially if you're not really on top of it. And that's why I always recommend definitely getting your blood work done if you ever want to get on or look at potentially starting a 5-AR. There's so many ads out there that now just, sign up from your phone and make it so easy, but they just don't express the levels of severity that comes with lowering your DHT. I found some really interesting information from the Bowtie Biohacker regarding a case study that was done on men taking 1 milligram of finasteride daily. So this is what it was done. The differences between the clinical trials and the private office follow-up influences were as prescribing and how they did the treatment. This was done in UCLA in California and by Marvin J. Rappaport, MD. He conducted this experiment. They had a total of 1,261 patients were monitored with phone calls every 3 months after finasteride was initially prescribed. So, they weren't monitoring how often they were taking the drug. There can be a lot of variables when it comes to this case. However, they did monitor them for 12 months with frequent phone calls to see how they were doing. The unfortunate part of the data is that 414 men of this almost 1,300 were unable to be contacted. So despite numerous follow-ups to attempts to contact them, a decent percentage of the candidates we didn't get the information from, but what they did find was something really interesting. They asked them 4 questions. Did the drug work? Did their hair stop falling out? And did their hair regrow? And when they say the drug worked, that means their hair stopped falling out, hair grew, or hair looked better. So that's what they mean by worked. And I didn't mean to say 4, I mean 3 things there. And they also asked them, was it a strong yes, a yes, not sure, or a no? And they ended up getting the results back from about 211 patients were the ones that they could actually say that they gave us enough information, their touch points were frequent enough. But they were saying that this is why blocking DHT isn't even the best solution for hair loss, ignoring the obvious mood, cognition, and strength and sexual function impacts that it will have. Hair loss, less than half of finasteride users see meaningful regrowth, and 30% aren't even sure that their hair loss slowed. So those are pretty big numbers and really different from what we get from the clinical trial data. I know that those are the numbers that I definitely see impacted more when it comes to the comments from social media and anecdotal reality. Of course, I haven't written all this down, I haven't studied it, but when you talk to thousands of people and you hear that, 20%-ish have side effects, severe side effects, had to stop, and of course you get the flip side of that, probably 20-30% of the people I talk to say they've been taking it for 5, 10, 15, even 20 years with no issues whatsoever. There's that information out there as well. It seems that it just comes down to who you are as a person and if it's going to affect you like it would affect other people. Yeah, that was a really interesting study that was done in Los Angeles at UCLA regarding finasteride, because if 30% of men aren't even sure that their hair loss slowed and less than half experienced meaningful regrowth, that does argue that reducing DHT in the body by about 70%, which is what finasteride does. One of the biggest medical recognitions and controversies regarding post-finasteride syndrome, I guess, is the challenge that faces the patients in lacking universal recognition within the medical community. And, I don't want to put on my tinfoil hat and be a conspiracy theorist here, but I would assume that the lack of recognition probably has something to do with big pharmaceutical companies realizing that the side effect profile may be a little bit larger than, they realize from their clinical trial data, and they're selling hundreds of millions of these pills and treatments yearly and making a lot of money from it because it is a reoccurring purchase. You have to keep taking it, and they probably don't want their, gravy train of money to stop. So they obviously don't want to recognize that it is something that is real, and they're going to deny until they have 100% proven without a shadow of doubt that it is, and that probably won't ever happen. And also they have, plausible deniability by saying the half-life of the drug is 6 to 8 hours. So after, months of being off the drug, why wouldn't you return to your baseline? They can say, well, this drug isn't even in their system anymore. We're testing them now. They must have something completely different that's unrelated to the drug, which is, bad when someone knows what they used to feel like before they're taking the drug. When they take it, they're completely different. The medical dictionary and regulatory authorities, the MedDRA, is significant now because they are recognizing the inclusion of 5-alpha syndrome. This is the official medical directory, suggests institutional recognition of the condition. So they are kind of calling it something different. That's the official name, 5-alpha syndrome, not post-finasteride syndrome. The FDA has acknowledged reports of persistent side effects and has updated finasteride's labeling to include warnings about sexual side effects that may continue after stopping the medication. However, advocates argue that the current labeling doesn't adequately warn about the full range of potential persistent effects. And, that's why I educate so many young men, and people come to me as using things like 5-alpha reductase inhibitors. They come to look at topical anti-androgens or just other natural alternatives to blocking DHT, or at least just trying to stop hair loss. I try not to be too fear-mongering here, but I do like to emphasize that there are severe repercussions with this drug. Now, me personally, I didn't have post-finasteride syndrome, but I did get those side effects from it. Once I stopped, they did go away. And for most men, that is it. And I do think, if you are someone who is going to be, scared of these side effects, you could just avoid it altogether. But if you are using a lot of different treatments and you're over the age of 21 and nothing seems to really be working for you, you could give it a shot. I would also just recommend trying with the lowest possible topical dose first. Topical seems to lead to a lower rate of DHT-related side effects. So you could do that, and if you are totally okay with it, keep going. And if you're getting good results, no need to try the oral version. The oral version just tends to lead to a little bit more of a larger side effect profile, and definitely don't start with anything higher than 1 milligram a day. You can even use it like 3 or 4 times a week, not every day. Several countries, including Canada and other European nations now, have also updated their safety information on finasteride to include warning labels about these persistent side effects. And organizations like the Post-Finasteride Syndrome Foundation and research platforms like Finasteride Watch work to raise awareness, fund research, and provide support to the affected individuals. They also maintain databases of patient experiences and coordinate with researchers studying this condition. When patients feel dismissed about their healthcare providers, it can compound the severity and delay proper support. And this is something that nobody ever really wants to experience, because sexual dysfunction in men is definitely a link to a lot of confidence boosting. And I can't tell you how severe not being able to function sexually, or at least feel confident sexually, does to your mental health, and really just ruins all other aspects of your life because it's all you can think about. Some men find partial relief when it comes to testosterone replacement therapy, though this doesn't work for everyone and can have its own side effects and risks. Taking TRT or, supplementing with things like, a DHT steroid, those can come with their own side effects, but, and maybe cause more hair loss than what the issue is. But at that point, I think having hair is probably going to be less of a worry than, suffering and getting rid of those post-finasteride syndromes. Another thing that is recommended, but is something that you could try, is something like a Cialis or a Viagra. I know that that's really not great medical advice, but something that I tried with, and it definitely got over the initial issues. And then once my side effects tended to go away, I could stop using that, but it was something that I had to supplement with. But it's like, if you're taking finasteride, then you have to take this drug. It's just like, what's the point of doing both? You don't want to have to be relying on sexual drugs to have sex when you're young. There's also been research into some neurosteroids replacement, but it's still ongoing, and some promising early results, but this is still largely experimental. And these are the people who have suffered with severe post-finasteride syndrome. We're talking about people who have been taking the drug and they stopped, and now it's been like a year and they're still suffering from those side effects, and even further on down the line. Yeah, so, that's interesting. While we can't predict who this is going to develop in, some potential risk factors that have been suggested include younger age when starting the treatment. That's why especially young men who are under the age of 18, do not start this drug, just because you are still growing, you still have sexual functions, you're still, with later and later puberty rates could still be growing, you are still growing at the age of 18. Long durations of use, really high dosage, and individual genetic factors. These are all things that contribute to if you are someone who's going to be really DHT sensitive. But yeah, long duration of use, it is something you're going to have to continue using. You could take tolerance breaks here and there, or just, not take it every day, every other day. Higher dosage, always start with the lowest dose possible. I mean, really like a micro dose. And if you do take finasteride, Pay attention to any of these side effects. If you notice sexual, mental, or physical changes, document them and discuss them with any of your healthcare providers. And if you experience any of these side effects while you were on finasteride, work with your doctor to determine the best course of action. Usually they're pretty easy to resolve, but there is the weird cases. That was a pretty brief example of it. I just kind of broke down what it is, some of the mental, physical aspects of it, mostly the sexual aspects, where you can go to get more information like Finasteride Watch. I'm not trying to fearmonger too much about it, but it is just something that I would stay away from unless you really want to try it, because it's like your last resort. But definitely wait till you're a little bit older, get your blood work done, be aware of the potential issues that it can cause, just be hyper aware, especially like the first month you're using it. All right guys, thanks for watching, and look forward to talking about more stuff in the future.